So CPPS-CP, Chronic Pelvic Pain Syndrome and chronic prostatitis. There's a great number of people, men and women, who have the symptoms and are suffering from symptoms related to these without necessarily knowing that's what they've got, that they've got chronic pelvic pain syndrome. That's because it covers several different medical departments. So it can be gynecology, it can be proctology, it can be musculoskeletal conditions, as well as urology. So because it spans several different medical departments, the symptoms but also the consultants that a person might see with these symptoms vary. So people often end up with multiple diagnoses. There are now very good guidelines for the treatment and the management of and diagnosis of CPPS, Chronic Pelvic Pain Syndrome, issued by the European Urology Department. And at New Medicine Group and I stick to the use of those guidelines. So it's very important to have an accurate diagnosis to exclude certain pathologies, certain neurological, certain musculoskeletal pathologies. Once that's been done, the appropriate treatment is then quite clearly defined, and that can be manual therapy, so body work or physiotherapy type treatment. Acupuncture is mentioned in the guidelines as being useful for several types of urological, so bladder pain, and any type of pain of pelvic origin does respond to acupuncture in particular. We also combine breathing therapy. We found that a very significant proportion of people with chronic pelvic pain have a dysfunction with the breathing pattern. So the respiratory diaphragm is not moving in harmony with the pelvic floor, the pelvic diaphragm. This may sound unrelated, but our experience and the research supports the fact that it's incredibly important. Poor breathing pattern, poor use of the pelvic and respiratory diaphragm leads to spasm, constriction and pain in the pelvic architecture, the pelvic muscles, the pelvic connective tissue. So with a very significant proportion of patients we will assess, and if we find a breathing pattern disorder we will give treatment and exercises and biofeedback to enable them to change those particularly poor habits. Sometimes there'll be several treatments at the same time. There might be dietary interventions, there might be manual therapy or acupuncture, there might be relaxation therapy, all happening at the same time for a particular patient, depending on the background, the symptoms and diagnoses. Other times we'll want to work through the treatment and the management options in sequence, excluding certain pathologies till we end up at a certain place that we know must be causing the problem, and then that particular management or treatment will be focused on. Something a lot of people, men and women with chronic pelvic pain syndrome, will recognise is having multiple diagnoses, being told their pain is psychosomatic or the dysfunction is psychosomatic, or that it's due to purely anxiety. That is incorrect. The older modern research shows that there is a physical pathology going on with pretty much all chronic pelvic pain, but there is also, in most chronic pelvic pain patients, a psychological or a stress element. It doesn't mean it's not real. It doesn't mean that they're in some way making the pain up. The pain is very real, but there is a stress, possibly emotional basis to some of the problems. There's a large number of treatment options for people with pelvic pain syndrome, and it's rare to not be able to at least offer management of the symptoms, and in many cases complete relief or exacerbation from the symptoms.